This exercise works the quadratus lumborum. Two versions of the exercise are featured in the video. The quadratus lumborum is a muscle of the posterior abdominal wall. It is located deep in the abdominal muscle and is referred to as a back muscle. It is irregular and quadrilateral in shape. The synergists of the quadratus lumborum are the gluteus maximus and the gluteus minimus. The antagonists are the adductor magnus and the quadratus femoris. The type of movement for this exercise is an extension of the core muscles. Hip raises are performed by people in order to strengthen the piriformis muscles along with the core and hips. They improve glute strength as well. The movement entails raising the hips while squeezing the glutes. The body movement is an abduction of the thigh at the hip. This exercise works the piriformis muscle, which assists with external rotation and abduction of the thigh. The insertion of the piriformis is the anterior part of the medial femur. The origin of the piriformis is the anterior sacrum. The synergists are the gluteus muscles, the maximus, medius, and minimus. The antagonists are the adductor longus, adductor brevis, adductor magnus.
The erector spinae is a bundle of tendons that extends throughout the lumbar, thoracic, and cervical regions. The insertion point for the iliocostalis lumborum is the inferior borders of the lower 6th and 7th ribs. The synergists for the lateral flexion are oblique abdominal muscles, rectus abdominis, and quadratus lumborum. The synergists for extension include contralateral fibers of the same muscles, quadratus lumborum, and serratus posterior inferior. The antagonists for lateral flexion include contralateral fibers of oblique abdominal muscles, rectus abdominis, and quadratus lumborum. The antagonists for extension include rectus abdominis and oblique abdominal muscles. The points of attachment of the iliocostalis lumborum are the iliac crest, sacrum, and thoracolumbar fascia. These attach to the lower 6th through 9th ribs. When raising the leg upwards during this exercise, the iliocostalis lumborum, which is located on both sides of your vertebral column, assists in bilaterally extending and hyperextending the vertebral column for support. There are two different types of movements in this exercise. They're called eccentric and concentric. The eccentric movement is when the hamstrings and glutes are being lengthened when you are squatting down. The body finds itself in a dorsiflexion position where the shins and feet are getting closer and closer to one another. When you are lifting yourself back up, it's called the concentric phase. Specifically, this exercise works the gluteus maximus, the gluteus minimus, and the gluteus medius. The insertion point of the gluteus maximus is the gluteal surface of the ilium and the sacrum. The point of attachment for the gluteus maximus is located in the gluteal tuberosity of the femur and the iliotibial tract. The synergist is the gluteus medius. The antagonist is the adductor magnus. The insertion point of the gluteus minimus is the anterior surface of the greater trochanter. The synergist is the iliopsoas. The antagonists are the gluteus maximus and the adductor magnus, and the point of attachment for the gluteus minimus is located in the outer surface of the ilium, lying right between the front and lower gluteal lines. The insertion point of the gluteus medius is the greater trochanter of the femur. The point of attachment is the surface of the ilium under the gluteus maximus. The synergists include the upper fibers of the gluteus maximus and the gluteus minimus, and the antagonists include the adductor longus, adductor magnus, and the adductor brevis.